All right, folks. We've got Dr. Tim Ryan on the phone. It's been a couple of weeks since we've had an opportunity to speak with him. He's been a busy guy, and as usual, he's busy, but we'll try to get all of our questions in while we have got this valuable time with him. Good morning, Dr. Ryan.
Good morning, Mark. Thanks for having me.
You're very welcome. Thank you for coming on. So it's been a long, strange trip, in the words of the Grateful Dead, and I feel as though we're in this great transition period with the COVID-19, and that we've been transitioning from no vaccine and widespread virus, and now we seem to have this substantial number of people vaccinated, and but still have viral counts that are above what we would consider acceptable levels. Where do you see us headed?
Well, that's a great question, Mark. I think we're headed certainly in the right direction. The next several weeks and months are really going to be telling in terms of where we end up. Do we end up just short of where we need to be, with the potential of us having to sort of double efforts and triple efforts come the fall? Or do we land in a place that we really want to be and all wish we were, in that the majority of individuals have been vaccinated? We can get rid of a lot of the mandates, masks, and other things and that sort of thing, and resume life as we knew it before. So that's, the next several weeks and months are really going to be telling in terms of getting this next 20 to 30 to 40% of the population, depending on where you look, get them vaccinated and really create that sense of herd immunity across the country. Because there are places and there are certain states where the vaccination rate is very concerning, primarily in the southeast, some in the northwest, where the uptake of the vaccine isn't what we had hoped, and so it's likely that we're going to have a resurgence in those states in the very near term.
I'm glad you touched on that. It's something I've been watching, and it seems sort of anomalous when I look at the incidence of COVID around the country. There's states where I can't explain. Maybe you can. There's no explanation that I've been able to find, put it that way, as to why there is such a reduced incidence in places where they seem to have taken a more casual attitude toward the virus than in others. But it just seems inevitable that this little chemical that's in the air that is just looking to attach to chemicals within your body is going to surge in places where people are susceptible. I don't know how else to put it.
Right. I mean, it's sometimes things you sort of have to peel that onion back and really understand the underlying layers. Texas is a great example. Texas's numbers haven't surged. Primarily because a couple months ago, if you recall, they had a significant surge, and a significant portion of the population was COVID positive, and so has a prior diagnosis of that. Couple that with vaccine rate, and it makes sense why they don't have a massive surge. Although, having said that, there are pockets in Texas, specific counties, that weren't impacted on that first go-around, are now seeing significant increase in cases in their county. So it really depends. It's further complicated by variants. The Brazilian variant, as an example. We just had our first known case in Colorado and El Paso County of the Brazilian variant. The Brazilian variant doesn't really care that you've had COVID before. It can reinfect you and sort of you're starting over. So all the more reason why you need to get vaccinated, even if you've had COVID in the past. Once you get past that recommended 90 days, we strongly encourage you to get one of the vaccines available. It's far more protective, sort of that umbrella protection against a number of the variants, including the Brazilian variant. So, nothing is 100% guaranteed, but protecting yourself as much as you possibly can is really what we're trying to move towards.
I also read that in India, which is the virus is completely out of control there, and I'm just waiting for the same sort of phenomena in Africa. I can just envision that happening. But I read that there's a new variant in India as well, and this brings, I guess it's sort of a larger picture. This is something that you would know more about, but I think that there's really two phases to this vaccination. One is the industrialized world. To keep the world economy going, it seems logical to get the United States and Europe and other industrialized nations back in full production as soon as possible to keep the world economy going. But at the same time, this logistic problem of vaccinating people around the world, where there are trillions of, the virus duplicating trillions of times a second, probably around the world. It's just inevitable that we're going to have these variants that are going to pop up, and before we can get the whole world vaccinated, and then that's then you have to have booster shots for everybody. It just seems like an ongoing problem that's never going to go away.
I'm strangely enough a little more optimistic than that, but I completely agree. The more this virus is allowed to fester and duplicate and replicate itself and mutate, more importantly, the greater the risk of a variant that now doesn't really care about the vaccine, meaning the vaccine is not effective. So it's in all of our collective interest as human beings to vaccinate the world as quick as we possibly can, because just because it's in another country or another continent, or there's a lake that separates us, we are still at risk. We're all in this together, right? We're all on Earth, and we don't have another Earth to go to. So the sooner we can vaccinate folks across the planet, the better. As far as Africa is concerned, I think Africa has experience that I think India doesn't. They've dealt with Ebola and a number of other highly contagious diseases that they are far more cautious, not nearly as populated as India, and that's really India's challenge at this point, right? You have 1.3 billion people. It's hard to go anywhere without millions of people around you. So that is their main problem. The other is politics are involved, similar to the way they were here in the beginning of this crisis. So hopefully they can get it sorted out and they can get enough vaccines and the supplies they need. But unfortunately, the reality is the next several weeks and months in India are going to be quite dire and quite grim. And that's going to be the case moving forward here for the next several weeks.
Okay. Well, let's step back for a moment and catch up on Clear Creek County. I heard you say that, and this is certainly great news, that the Pfizer vaccine is going to be available very shortly, maybe next week, I think I heard, to a pediatric population age 12 and up. And let's just expand on that a little bit. You're going to send out notification to parents, am I right on that?
Yes, actually I'm sending the letter today through the school, through Chris, the principal there at the school. We'll be sending a letter to the parents, informing them of this potential availability next week, as well as the fact sheet for the Pfizer vaccine. Once we get a head count of individuals who will plan to get it at the high school, middle school, we will contact CDPHE and order those doses. And hopefully next week, once it is approved, we can, within a day or two after that, start administering that vaccine to those folks. It's particularly important because right now under 16 is completely vulnerable, and they have no formal way of protecting themselves other than with masks. And it's going to be even more difficult once they break away, so to speak, from the school and their sort of cohort in the county, and are now intermingling through summer and summer camps and all that sort of stuff with kids who come from other states, other countries potentially. And so it's really important to get as many of those kids vaccinated before they embark on their summer. So we're going to attempt to get them their first vaccine at the high school, middle school in the next week or so, and then follow up with another clinic 3 weeks from that point to get them their second dose and really send them off into summer with the level of protection that they really need.
Well, that's certainly great news. You're right. There's reasons to be optimistic, at least on a local level. I will follow up with this pediatric issue to say that I read today that 22% of the new cases are pediatric cases across the country, and which speaks directly to something you said in your COVID update this week, that the viral infections are among the people who are not vaccinated, and that includes the pediatric population. The sooner we get them vaccinated, the better off we'll all be.
Exactly. And so as it becomes available, hopefully in the next few days, we can make that available to the kids in the middle school and high school. And it's unlikely that the younger than 12 will be vaccinated anytime soon. Those clinical trials are still ongoing in the 0 to 12-year-olds. And so hopefully by next winter, at the start of winter next year, so sometime in January or so, we can get those younger kids vaccinated and have a full spectrum in terms of our population vaccinated.
Yeah, I was hoping that maybe by school, at the beginning of school next year, they could have vaccination for the younger population. But even if it's just next winter, that doesn't sound too bad. I guess that's what we'll have to wait for. I wanted to talk a little bit about long haulers. I've been reading more and more about this percentage of the population that has been infected with COVID that continues to have symptoms long after they're testing positive. And they say that it's about 10%, 1 in 10 people who contract COVID, no matter the degree of severity of their symptoms, they are exhibiting one or more long-term physical problems. And I wonder if you have any thoughts on that. Is this predictable that would have happened, or is this unique to the COVID-19?
Great question. And so I just happen to live with one of the many researchers around the world who are undertaking this very question. My wife is running a clinical trial in those individuals who have had COVID, or PCR confirmed positive, and following them. Currently they have 125 or so individuals enrolled, and they're collecting a number of different samples on a regular scheduled basis. Trying to better understand why is it that individuals haven't gotten rid of that pneumonia-like cough or continue to have the brain fog that many people report, or still haven't gotten their taste back or smell back. So I know there's a great amount of research out there, a number of studies like my wife's, trying to answer that very question. This is quite unique to COVID in that most things like COVID, the flu or the cold, once you no longer have the cold, you don't have cold-like symptoms or the flu. And so it is quite unique to COVID, and that's why people like my wife are really trying to understand that and understand the complexities of COVID in these individuals. Because, like you said, there's some people going on a year now who got it early who still have not been able to get rid of their symptoms.
So I guess the only thing that those folks can hope for is that they can maybe mitigate those symptoms through, I don't know, some kind of medication, or hope that eventually they'll go away. It just seems so strange to me that you could have no symptoms, be one of those 25% of people who contract COVID who never were symptomatic, but then still have some existing long-term effect from the infection. It just seems so strange.
Yeah, and anecdotally related to that, there are individuals who have those symptoms for many months. And then decide to get the vaccine, and post-second dose of their vaccine, those symptoms magically go away. So they're also looking into that. What is it about the vaccine that is sort of kicking their immune system into high gear and allowing it to overcome those symptoms they've had for many months? So lots of questions out there being answered. And I know the NIH is actively looking at a number of proposals that have been put forward, two of which from my wife, and looking to fund those studies more long-term so they can follow these individuals for 6 months, 12 months, and beyond. And then looking at them post-vaccine. How are their bodies reacting to the vaccine given they had these symptoms for so long? So it's, lots of questions, but lots of smart people trying to answer them as we move forward.
Well, that's hopeful news for those people who are suffering long-term consequences, and we wish them nothing but the best. I would like to ask you to elaborate a little bit about the vaccine clinic schedule as we're going forward here in Clear Creek County. I heard you say that there's going to be this pop-up clinic at King Murphy, and that you were planning other clinics throughout the community. What can you tell us about that?
So, yeah, we're now shifting into a little bit different model. As most people are aware, we're having a larger vaccine clinic on Wednesdays in Dumont at the EMS station. We're going to be moving now more towards a mobile effort and try to do a number of different clinics across the entire county, choosing different days, different times of day. Tomorrow, for example, we're doing a clinic at King Murphy Elementary School to address the need on the eastern end of the county from 8 to 10. It's walk-up, so basically you don't need an appointment. You just show up, fill out the simple form we have, and get your vaccine and be on your way. And then simultaneously here in Idaho Springs at the Resource Center on Colorado Boulevard, we're going to be doing a walk-up clinic as well. A number of individuals who are getting their second dose, but anyone who's interested in getting their first dose. We have both Johnson & Johnson and Moderna vaccines available and will for the foreseeable future. And then this Saturday, we're going to be at the other end of the county in Silver Plume and do a Saturday clinic at the train museum there in Silver Plume. So all of these are going to are on our website and also on our Facebook page and a number of other areas. So we're going to be moving around the county, going up to St. Mary's Alice, over to Empire, and really trying to make it as convenient as possible for individuals who haven't, for whatever reason, haven't gotten around to getting scheduled. They work or whatever reason, try to make it as available as possible so that we can get our numbers back up to where they need to be in terms of our community immunity and protection.
Well, that's certainly encouraging to hear that people are going to have that convenient opportunity right in their neighborhoods. Glad to hear that they're doing that. And let's just remind everyone that schedule is on the clearcreekcounty.us webpage. And just click on that COVID-19 button and you'll find not only the schedule of vaccinations, but all the great information that's been compiled by your Department of Health here in Clear Creek County. It's really an invaluable tool, and I check it on a regular basis, and I would wish everyone to do the same. Knowledge is power. Well, I'd like to finish with one last question that I have for you, and then, of course, anything that you'd like to share. But am I ever going to be able to think about a world with no mask?
I think so. I think it's going to take time, as we've discussed. As long as the virus is rampant around the world, we're going to need to take precautions. Doesn't mean you're not now safe as a vaccinated person, and as we get more and more folks vaccinated in our county, in our state, in our country, hopefully those mask mandates can go away and allow people to move more freely. The CDC guidance is changing regularly around that, and the need for masks outside, as an example, when you're around vaccinated folks is no longer necessary. So it's really when you get into these tight, confined spaces, restaurants, shops, etc., where masks aren't worn, restaurants in particular. We don't know the vaccine status of most people. So until we can get to a point and a level of confidence that the majority of people are vaccinated, it's going to be required, because, someone just saying they're vaccinated doesn't necessarily mean they are. We do know there are far too many people still who haven't been vaccinated. And so trying to get them in, and through our efforts, trying to make it as convenient as possible to get that vaccine and create that community immunity. I mean, people want life back to normal and want things to open up. The quickest way to do that is to get vaccinated. The sooner we get vaccinated, the sooner we can resume life without masks and do the things that we enjoy so much and have missed for the last year.
Yeah, I hear what you're saying. We have that part of the population that seems adamant in their objection to being vaccinated. And on a personal level, Doc, I'm a gym rat. I love going to the gym. It's one of the things that keeps me sane in my life. And I'm not going to take my mask off anytime soon. I don't know what the vaccine status of people in the gym might be, and I don't care how good a ventilation system you are. When you're, you're 6 or 8 feet from someone and they're huffing and puffing and you're sucking air as well, I don't see an end game there. I don't know how that goes away without my particular favorite solution, the vaccine passport.
Yeah, I mean, we're going to do our best here at Public Health to educate people as best we can and overcome all of that misinformation that's out there around vaccines and that sort of thing, and try to do our best to make it so that you can go to the gym without a mask. But, we can't control people's behavior completely. We can only guide them and help them and educate them as best we can and hope they make the right decision. But I think once we get our numbers up to a reasonable level in terms of vaccine protection, it dramatically reduces your potential and your potential risk. So in addition to vaccines, it's also getting case counts across the country down. 50,000 is where we're at now, roughly speaking, which is still far too high. And most counties are still not contact tracing because their numbers are just too great. So it's really about getting those cases down and making it so it's less relevant and less impactful on our lives on a daily basis.
So we get the cases down by, let's see, vaccination, mask wearing, social distancing, hand washing, and all of those safe behaviors that we've been instructed to through guidelines in the last year to abide by and get a vaccination, right?
Exactly, Mark. You've been listening.
Well, if we could get a few more people to listen, that'd be great. I don't know how to do that though, and but I'm gonna think about it until our next conversation. Thank you so much for joining us today, Dr. Ryan. You're always insightful and so much great information. We deeply appreciate your time.
Thanks. Be well.
Goodbye. Okay, everyone, that was Dr. Timothy Ryan. We sure appreciate his sharing of his time with us and all of his knowledge. And if you haven't been vaccinated, talk to some of your friends who have been vaccinated and find out what their experience was, and compare that to the potential disaster that could await you if you were infected with COVID-19. Not just you personally, but think of it as you don't want to be a vector of disease for other people in your community, people that you love and care about, and the only way to protect them from you is for you to be vaccinated. So please, consider being vaccinated if you haven't been. I've done it. No big deal. It was easy. I haven't grown any extra appendages, and I don't expect that I will. So get out there, get yourself vaccinated. We'll talk to you next week. Keep yourself safe. Here's some recorded music for your listening enjoyment. Goodbye.